CMS is committed to helping patients, families, and caregivers make informed decisions about end-of-life care. Toward this goal, CMS established the Hospice Quality Reporting Program, or HQRP. The HQRP quality measures reflect care across the hospice stay. These measures help inform patients, families, and caregivers when they select a hospice. Data submitted by all Medicare certified hospice providers through the Hospice Item Set, or HIS, Medicare Fee-for-Service Hospice Claims, and the Consumer Assessment of Healthcare Providers and Systems, or CAHPS, hospice survey are collected by the HQRP, including assessment-based measures, claims-based measures, and CAHPS survey-based measures. The HQRP promotes patient and caregiver engagement, strengthens provider-beneficiary relationships, and supports ongoing data collection while also minimizing reporting burden. The first measure in the HQRP is the HIS-based Hospice and Palliative Care Composite Process Measure, also known as the Comprehensive Assessment at Admission, which reflects the quality of care upon admission to a hospice. This quality measure is collected via the HIS and is based on 7 care processes hospices should assess for all patients during admission. This assessment identifies care needs, including pain, symptom management, and treatment preferences. This measure is interdisciplinary, holistic, and aligns with consumer expectations for hospice. The next HQRP measure, capturing care across the hospice stay, is the Claims-Based Hospice Care Index, or HCI. HCI combines 10 quality indicators reflecting different aspects of hospice care into a single score that patients and families can readily use to compare hospice providers. The index score represents aspects of hospice care delivered from admission to discharge. Each of the 10 HCI indicators are weighted equally, representing the important role each plays in quality of care throughout the hospice stay. The next HQRP measure, reflecting care provided at the end of life, is the Claims-Based Hospice Visits in the Last Days of Life, or the HVLDL. HVLDL helps to identify whether hospices provide visits that meet the needs of patients and their caregivers during this critical period of hospice care, the last days of life. HVLDL reports the proportion of patients who received in-person visits from a registered nurse or medical social worker on at least 2 out of the last 3 days of the patient's life. These visits are an important part of ensuring quality of care at the end of life when it matters most. The CAHPS Hospice Survey Measure assesses the family and patient experience of care after the patient's death. This survey includes the family's experience of the hospice care received and upon reflection, their overall rating of the hospice, and willingness to recommend the hospice. Through quality measures, the HQRP provides holistic insights into hospice care and helps patients, families, and caregivers make informed decisions to assist in selecting a hospice. In addition to Care Compare, please visit cms.gov and search HQRP to learn more.